Hi everyone, this presentation covers Chapter 23 on collecting qualitative data in the third edition of Jacobsen's textbook, Introduction to Health Research Methods, a Practical Guide. In this chapter, you will learn that qualitative studies collect data using a variety of observational and participatory methods. Here is an outline of the chapter. Section 23.1 provides an overview. Section 23.2 covers in-depth interviews. Section 23.3 covers focus group discussions. Section 23.4 goes over observational methods. Section 23.5 covers other techniques. Section 23.6 covers community-based participatory research. And Section 23.7 covers consensus methods. Section 23.1 Overview. So in qualitative data, the data collection method typically is not a survey. It's usually something like an in-depth interview where it's done face-to-face, or a focus group where it's done face-to-face but typically with a larger group of participants. So in-depth interviews typically are just one interviewer and one participant, and a focus group is usually one interviewer and then multiple participants. Qualitative researchers are closely engaged with the participants in this type of research. And so Jacobsen really brings out some important things about the researchers when you're conducting qualitative research, is that you should really reflect on how your background may bias your observations and be transparent about these biases when designing rigorous studies and reporting the findings. So Section 23.2 goes over in-depth interviews. So typically in an in-depth interview, the interviewer spends 1 to 2 hours interviewing a key informant using open-ended questions. So that's a very key characteristic of qualitative studies, is that typically the questions that are asked are open-ended. So it's not where people have specific choices to answer. They will actually expand on what their choices are and expand on what the responses would be. A semi-structured interviewer is, or actually the semi-structured interview is when the interviewer starts off with a list of open-ended questions, and then they're just a starting point to elicit responses. So you may actually transition to different topics based on how the interviewees answer those questions. So Section 23.2 goes over probing, and this is an interviewing technique that prompts interviewees to provide a more complete or specific response. And so here's where the interviewer may ask a question and a certain theme may keep coming up from the participant. They keep asking them about barriers to receiving health care, and maybe it's that they don't have time off of work. And so then they start to ask them specific questions about their job. Or it could be that they keep saying that a barrier is transportation, and so then they may focus more on transportation. Interviewers can also record observations of the body language and other nonverbal communication conveyed by the interviewees. And so Section 23.3 goes over focus group discussions. So focus groups typically are larger groups, so it may be about 8 to 10 people is what Jacobsen recommends. I'd say they're usually a little smaller than that from my experience. But typically it's a 1 to 2 hour participation in a moderated discussion. And usually there's interaction among participants. And the idea of having people there together is because then it stimulates a richer response and clarifies opinions. So typically homogeneous sampling is used to recruit participants with similar backgrounds, experiences, or perspectives. And so they are able to feed off of each other to get a more broad, richer set of responses. Now these are often audio or video recorded so that transcripts can be created. And so in a focus group, typically a facilitator poses questions to the group, and then they'll try and keep the conversation focused on a core discussion item, but moving forward at an appropriate pace. And so sometimes you would ask a specific question to one person within the focus group, and then you would hope that someone else would say, oh, I want to talk about that too. But maybe they don't. So then maybe the moderator needs to call on someone else to try and get their responses brought in, because you don't want just one person to be dominating the conversation. And there's definitely some specific trainings that are available for helping on that. Section 23.4 goes over observational methods. Observational methods are systematic observations of human interactions and human actions. And a couple of different types are naturalistic observation and controlled observation. And a naturalistic observation really is when the researcher just observes people in their natural setting, and participants are typically unaware the observation is being done. Versus a controlled observation is, say, a laboratory setting, and participants are usually very aware they're being observed. And so their behavior may be different in this natural environment versus a controlled environment. Participant observation is when trained interviewers seek to understand a community by engaging with its members and immersing in its practices. When researchers are involved in these types of observation, they usually have field notes, and field notes are their data. So these are the observation records, interview transcripts, or any other documents compiled during the qualitative research process. So some other techniques that are used for qualitative methods are an oral history, a narrative inquiry, or triangulation. So an oral history is an audiovisual recording of historical information about individuals, families, groups, or events. Narrative inquiries are more personal and longer things like audio biographies, personal letters, family stories, interview tapes, anything that can help the researcher understand how the people frame their identity and their social relationships. And then all of this information is taken together into a form of triangulation. So you take this narrative inquiry and oral history and then use multiple types of data, methods, and theories to better understand a phenomenon. Photo voice is something that's used a lot in public health programs, and this is where participants take photographs that may represent their community and then share what aspects of their lived experiences are intended to capture those images. There could also be vignettes, and these are brief written or pictorial scenarios designed to elicit a response from participants. Another thing that Jacobsen talks about is the think aloud protocol or the talk aloud protocol, and this is where participants are asked to describe thoughts and actions while completing a task. Section 23.6 goes over community-based participatory research methods. Now, I would say that this is listed in the qualitative chapter. However, community-based participatory research does not need to be only qualitative. You can do quantitative studies by using this method. CBPR uses partnerships that link academics and community representatives. And so it's meant to develop shared research priorities with the community. You don't want to say, okay, I know that cardiovascular disease is the #1 cause of death among women in the United States. I'm going to go out to these churches or these community centers and have a cardiovascular disease prevention program for them. Because if you go out to those communities and actually find out what their needs are, they may say, that's great, that's wonderful, but what we really need is access to get food, or we need some other resources. And so it's really designing and implementing appropriate ways of helping those communities based on your expectations expertise as a public health professional, but also what their wants and needs are as a community. And you can take the findings from research there to develop new policies and programs for that community. And so they usually use mixed methods approaches. There are usually some sort of qualitative component, but a lot of times CBPR also uses surveys. Section 23.7 goes over consensus methods. So the goals of some studies are to identify a consensus or an area in contention among individuals who are experts on a topic or a particular community or organization. And so Jacobsen talks about the Delphi method. This is a structured decision-making and forecasting process in which experts complete questionnaires. A facilitator summarizes and then shares the responses, and then panelists reconsider perspectives after reflecting on the opinions expressed by others. All right, so that is it on chapter 23. I will say that I do mostly quantitative research, so it's interesting to learn a little bit more about these methods here in this chapter, but you will probably be exposed to at least some in your other coursework, some information about CBPR as well as using photo voice as a student. So thanks for listening.